Today we will discuss the definition of visual impairment in the educational setting, look at visual simulations through pictures, and discuss the most 5 common visual impairments in children. Let's talk about what it means to be a visually impaired student in the state of Kentucky. To qualify as a visually impaired student, certain criteria must be met, such as low visual acuity, limited visual fields, a progressive eye condition, a functional loss of vision, or a diagnosis of cortical visual impairment. This information will need to be included on the KIMRC eye report downloaded from the Kentucky School for the Blind website by a licensed optometrist or ophthalmologist. As the term indicates, a visual impairment involves an issue with sight which interferes with a student's academic performance. The Individuals with Disabilities Education Act, or IDEA, officially defines the category as an impairment in vision that, even with correction, adversely affects a child's educational performance. The term includes both partial sighted and blindness. Low vision is the term used to describe significant visual impairment that can't be corrected fully with glasses, contact lenses, medications, or eye surgery. Legally blind is considered 2200 to 2400 with a severe low vision impairment. 2400 to 21,000 is a profound visual impairment and is very close to total blindness. Total blindness is the lack of light perception and is a total visual impairment. The visual field loss must be that of 20 degrees or less, and this is also called tunnel vision or the lack of peripheral vision. Blind spots are also examples of visual field loss. The acuities listed give an idea of what a student can see and gives the teacher of visual impairments a starting point when performing the functional vision learning media assessment, or FVLMA, for eligibility purposes. Birth defects, eye injuries, eye diseases, or health disorders can cause a vision loss. At this time, it is estimated that 2.9 million Americans have low vision, and this is expected to increase by 72% by the year 2030. This is including all age levels, elderly to birth. I hope the video gave you a good idea of what a student or a person with visual impairment lives like on a daily basis. The following are pictures of refractive errors. The first picture is of a normal image that someone with 20/20 would see. The second picture is of nearsighted or myopia. As you can see, the images in the distance are somewhat blurred. The third picture is farsightedness or hyperopia, and the images in the near vision are actually blurred. These images are a simulation of astigmatism and retinal detachment. They are compared to normal images of what a person with 20/20 might see. Astigmatism is the common imperfection in the eye where the front of the surface of the cornea is curved. When the light comes into the eye, the curvature of the lens reflects light, causing blurry vision and nighttime streaks. A retinal detachment itself is actually painless, but warning signs appear just before it occurs or has advanced. Flashes of light in one or both eyes, blurred vision, gradually reduced side or peripheral vision, and a curtain-like shadow over your visual field. The following images are simulations of double vision, color blindness, and constricted field loss. Double vision or diplopia occurs when a person sees a double image where there should only be one. The two images can be side by side, on top of one another, or both. The condition can affect balance, movement, and reading ability. It can affect one or both eyes. A person with color blindness has trouble seeing red, green, blue, or a mixture of these colors. The most common type is red-green color blindness, where red and green are seen as the same color. A visual field defect, or constricted field loss, can be a blind spot or a blind area within the normal field of one or both eyes. In most cases, the blind spots or areas are persistent. Now let's take a look at the 5 most common visual impairments in children. The first of these is cortical visual impairment, or CVI. CVI is a visual disorder resulting from damage to the optic nerve and or parts of the brain that process and interpret visual information. Some characteristics of CVI are that these students prefer a certain color, especially red or yellow. They are usually attracted to movement. They have poor visual attention and sometimes prefer a certain visual field, such as the left, right, upper, or lower. They also have difficulties with discrimination and interpretation of complex visual information. Children with CVI need simplicity. It's important that the object presented is simple and that the background and the environment are simple. For example, putting a solid black cloth behind a single colored toy helps to reduce the visual clutter. This creates a simple environment and a matter of eliminating noise and anything else that might distract from the visual task. You can also use movement to increase visual attention and use their preferred color in as many toys as possible. Retinopathy of prematurity, or ROP, occurs in premature infants. The major risk factors are the degree of prematurity and low birth weight. ROP can be characterized by retinal scarring, strabismus, total blindness with decreased visual acuity, severe myopia, and some may develop glaucoma. Visual efficiency training in organized searched grid patterns for those with decreased visual acuity or total blindness. You can reduce glare by covering windows and facing them away from the window, and they may need visual efficiency training to develop those scanning skills. A nighttime orientation and mobility evaluation may need to be conducted for those students who experience nighttime blindness. They need to avoid contact sports and other high-risk physical activity to prevent retinal detachment as prescribed by their doctor. They may also benefit from magnification and access to auditory materials. Albinism is the total or partial absence of the pigment of the eye, causing abnormal optic nerve development. Lenses and tinted lenses may be prescribed by your doctor. Characteristics of albinism can include decreased acuity, nystagmus, muscle imbalance, photophobia, increased sensitivity to glare, eye fatigue with close or detailed work, and can also include reduced depth perception. Teaching tips can include magnification. Magnification can be a handheld magnifier, electronic magnifier, screen enlargement software, or enlargement of written work. These students may also benefit from high contrast materials, a reduced glare environment that may need to use sunglasses, visors, or hats, outdoors and sometimes indoors as well. They may also benefit from frequent breaks during work. Optic nerve atrophy is a hereditary disease or can be acquired by damage to the optic nerve that limits or stops transmission of visual transmission from the eye to the brain. Type 1 optic atrophy is progressive. Optic nerve atrophy can be characterized by fluctuating visual performance. Visual perception may also be impaired. They may have photophobia, and night vision may be reduced. Teaching tips for optic nerve atrophy include providing supplemental visual information with tactile and auditory information. It is important to provide visual stimulation in infancy and early childhood, along with low vision training to help the child interpret visual information. Providing high illumination, especially when indoors, by using lamps, will help the child to see the information better. If they are photophobic, you may need to use sunglasses, visors, or hats, outdoors or indoors. Provide high contrast materials. They may also need magnification, such as large print or a handheld magnifier. And they may need to avoid visual clutter. This includes cluttered clothing. Optic nerve hypoplasia, ONH, and septo-optic dysplasia are related disorders of the early brain development. It is congenital, means it occurred during birth or before birth, and it is a non-progressive condition. ONH can be characterized by decreased visual acuity, nystagmus, may have better acuity in one eye than the other. They may have strabismus or limited field restrictions. Visual perception may also be impaired. Teaching tips include high illumination, high contrast materials presented. They may need magnification, including large print materials, handheld magnifiers, or screen enlargement software. You also need to avoid visual clutter and avoid busy backgrounds also. Our services are provided free of charge to your district from the Kentucky School for the Blind. If you have any questions, concerns, please contact me, KSB Outreach Consultant, Toni Hardin, serving the Kentucky Valley Educational Cooperative.